everyone. Today we are here to discuss one case that we saw a few days back, and I thought it's good idea to discuss this case with all our viewers for awareness. So Dr. Siddhant, can you please tell us about this anti-rabies shot that was given to this dog?
So we got a dog, he came with a bite wound, and the bite wound was unusually large. So when I examined the dog, I found that it was not a conventional bite wound. Bite wounds are normally puncture wounds and they are quite small.
Right.
But this wound had increased to a huge size.
Right.
Very shortly we realized that it is an old wound and it's not a fresh wound.
Right.
Because the wound had plenty of pus in it, maggots were there, plenty of dead tissue in it, it was stinking. So we realized that this wound is not a fresh wound. There has been a significant delay in the post-bite anti-rabies schedule for this particular case, and that is where I feel that all of you should be aware that whenever faced with a situation like this, you should immediately seek your veterinarian's help. Within 24 hours of a dog bite, whether the biting dog is vaccinated or not, you should take your pet to your vet and get your pet vaccinated.
So if you're talking about maggots, it means there would have been a delay of at least a week's time, I'm assuming.
Yes, at least 5 to 6 days.
That's
surely.
quite a lot.
Yeah.
To be putting the animal at risk and also the humans around, right?
Yes, yes. So post-bite schedule is important. Even if your dog is vaccinated previously for anti-rabies, a post-bite schedule is what we recommend because that is going to stimulate the immunity more and offer better protection to your dog from the rabies virus.
Right. So I have a question, doctor.
Yeah.
In this case, the dog was unknown. But what about there is a known case, like if we have two pets at home and they indulge in a fight and they attack each other and there is a bite, and we have the vaccination history as well. So should we still go ahead and tell them to take the anti-rabies shot all over again?
So for two pets from the same household who have had their shots completed, the risk of getting rabies is very less.
Right.
So in that case, an entire post-bite schedule may not be necessary, but at least 3 shots of the post-bite schedule will be necessary. Conventionally, we give 5 shots, but 3 shots for household pets who are in the same household and who have had these encounters.
We will still recommend
We
that.
would still recommend just to stimulate the immune system more,
Right.
and at the same time also take the necessary precautions.
So very important point, viewers. Please consult your veterinary doctor if you have ever been in such a situation, because they know the best, they are the experts. So it's always good to seek experts' advice in such a situation. And also, what about the humans? Here, this was an unknown case, like unknown pet, or sorry, it was a community animal, right?
Yeah.
So a community animal attacked the pet, so we don't know whether the community animal was vaccinated against rabies or not. So what would we advise the humans in this scenario?
So when you don't know the vaccination status of the dog who bit your dog, in that case we also recommend the humans coming in contact with this dog to get vaccinated. Not because that dog bit you, but as a preventive measure. Because in the future, if a contact occurs, then you should have, your body should be immune to it.
Right.
So even the humans need to get preventive shots from your physicians.
Great. Anything else you would like to add, doctor, to it?
Just one thing, that whenever a dog bite case is there, every pet parent should be aware of these things and they should take immediate action and not delay.
Right. Okay then, thank you so much everyone for watching.